Hey everyone, welcome back to my channel. I'm Tori Kest, and today I'm going to be talking about my 8-week post-surgery update, everything that has happened over the last 4 weeks since we've spoken last. There has been some changes, there's been some ups and some downs. Let's go ahead and dive in and get started. So starting off with where we left off. Later that day, Me Aesthetics called me back, finally reached me, and prescribed me a stronger antibiotic. So I immediately went that day, started the antibiotic, and was feeling better. When she prescribed the medicine, she also mentioned that she wants the surgeon to see me to decide whether I should have a pigtail drain or not. So she was going to set me up with a virtual appointment, and I go into talking about that in this clip I'm going to show now. Hey everyone, so back down in Miami, and a lot has happened in the last week and a half since I posted my 4-week updates. I had crazy fever, I had crazy infection, I had a flu at one point, which I am 99% better from now. My husband Steve has been draining my seroma for the last, week and a half, about every 3 days. And I'll insert a collage of the photos we took of each of those draining sessions and what he collected here. All right, so I asked Mia about possibly putting in a new drain, and they agreed, the surgeon needs to see me. So I talked about, okay, well, I can come down, but I want to make sure it's worthwhile because, it's a long drive for me to go all the way there and all the way back home for nothing. And so they said, okay, well, let's go ahead and set up a virtual appointment. It's going to be at 6 a.m. or sometime between 6 and 8 a.m. tomorrow morning, is what they said. So I said, okay, that's fine. We'll do a virtual appointment. Dr. Scroggins will see me, and he'll assess my seroma virtually and decide if I need to have a drain put in. If I do, then I'll drive down and get it placed. So the next day came around, virtual appointment never happened. I expected, okay, well, he's probably super busy. A nurse is probably going to call me and let me know. No one called me all day long. So around 4:30 that day, I called Mia and told them what I was waiting for someone to call me all day long, and nothing happened. And so they said, okay, well, we're going to go ahead and try to do this again tomorrow. I'm like, okay, so virtual appointment between 6 and 8 a.m. Never happened. I'm like really getting annoyed at this point, thinking that they're just pushing me off. In the meantime, I'm miserable. My seroma is growing. My husband is draining me. It's not numbed, so it hurts every time. So I call them. Since the second one didn't happen, the second virtual appointment didn't happen, I called them back that day, and I get pushed from department to department. I ended up in pre-op. I was talking to someone in pre-op, and I'm like, why? I'm like, not trying to offend you, but why am I talking to you? This is not who I need to be talking to. I have a seroma, and we need to drain it. And then so she put me on hold to try to get me to the right department. Anyway, it was 4:43. She came back on the line. Okay, well, I found out what happened. So the Miami clinic is closed right now. 4:43, the Miami office was closed. Okay, she's like, I'm going to go ahead and expedite your call, and a manager will be contacting you back. I'm like, okay, that's fair enough. Thank you for your service and your help. About what time should they be calling me? Because I want to know, is it today or is it going to be a different day? She says, anytime, either today or tomorrow. Okay, thank you. You have a great day. So, no one called me that night. No one called me the next day. At this point, I've given up on Mia. I figured, you know what? They're not doing what they're going to say they're going to do. And my husband's draining me. Fine. I'm going to give up on Mia. The next day rolls around. So that would be Friday, which is yesterday. Actually yesterday. Today is a Saturday I'm recording this. Friday rolls around. Out of nowhere, I get a text message. Please confirm your appointment for Saturday. I'm like, oh, okay. Apparently the manager didn't call me. I have to assume at this point, which everyone knows, assuming makes an ass out of you and me. But no one called me, but I got a text message. Please confirm your appointment, Saturday morning, 7:30. I confirmed it. I'm like, okay, this is great. They're gonna drain my seroma, or they're gonna put in a drain. This is great. So we drive down to Miami. We arrive at 7 a.m. We're waiting around in the lobby. 8 o'clock rolls around, still not called back. Finally get called back. And the lady's like, hi, you're here for breasts? I'm like, no, I'm 5.5 weeks post-op. I have a seroma in my abdomen. I lift my shirt and I poke at it and I show her. She's like, oh, like, you have the right name. And I see my chart is right in front of her. I don't know why she's thinking I was there for breast. So she calls some other lady in, speaking a different language. And I'm like, yeah, in English, please. And the lady's like, yeah, I know why you're here, but we don't have any doctors. And I said, okay, that's fine. I just need to drain my seroma. No, we can't drain it. Only doctors can do that. I'm like, okay, well then why am I here? Yeah, I don't know why you're here. But why was an appointment made for me if a nurse can't drain the seroma, if only a doctor can? Why am I here? No, I don't know why you're here. What the heck? So now I'm stuck with the seroma still, and we're going back to the hotel. Luckily, I have an intuition, and so does my husband, and we had a feeling we might need to have a needle with us for draining it ourselves, just in case something like this happened. And so we are prepared to drain it at the hotel. We just bought lidocaine cream, we have alcohol, we have gauze in the room, and a heating pad, so I'm going to use the heating pad after I drain it. And I'm just done, just totally done with Mia Aesthetics. It's a factory, and the surgeons are great. You know, they do fantastic work. The post-care is bullshit. It really is. So, that's my clip for right now. Okay, so we just got back to the hotel, and I wanted to show you guys what my seroma looks like right now. This is the skinny side. This is where it's at. The guys can see like the dome shape here, but on this side, it's kind of flat. So it goes flat, and then it domes on this side. Let me show you the overhead view. This is the overhead view. You can totally see it. Like, it's flat, and then it domes out. It's totally stretching my skin right now. So we just numbed the area that we're gonna poke, and we're gonna drain it out, and then I'll be flat again. So I'm gonna record that part, and I'm probably gonna fast forward, but you guys can watch. Okay, so let me show you what we have. I've already numbed the area, and when it's time to poke, we're gonna be using alcohol to clean the area with fresh gauze and an unliquid one just in case we need extra. Here is my nemesis, 18 gauge needle, and the syringe is 20 ml. We do this a few times. We drain it into a clean cup, and when we're all done, I lay back and relax and use a heating pad. I'm not ready, but here goes. We're not training anyone how to do this.
Any amateurs out there that
this is for entertainment purposes only, that
want to do it themselves. You can buy these off of Amazon. This one's an 18 gauge needle. One thing you want to do is make sure that you can loosen and unloosen this. You only want to do that if you intend on doing a manual draw of the fluid, squeeze, reassemble, manual draw, release, squeeze.
The benefit there is the needle stays in you and you only have one poke. But again, this is for entertainment purposes only. We're not giving medical advice.
And then you never want to poke, withdraw, and then poke again. You don't want to do that. So it's a one-time insertion tool. You insert it once, and then if you have to repoke, you grab another one. If you remove the cap like that, you'll know the moment you hit the seroma because the fluid will start to fill the cavity space. If you leave it in, regardless if it's this much or this much or that much, when you hit the space, you don't get an indicator that you've hit it.
In other words, you might poke too deep and miss the seroma altogether.
It's possible. So I like to just engage it with that, have the cup ready to start catching the fluid, and then we'll take this part off, and then you'll just leave that part in and just let it drain into the cup. That's how my wife likes it done. The draw method would be a lot faster.
We do it sometimes.
It would be a lot faster.
But however, I don't know if I'm really in tune with my body or just really sensitive or it's all in my head. But I feel like woozy when we draw it out fast. Like the pressure in my body is changing. I just get woozy. You know, like the people who see blood and pass out? I'm not normally like that, but I get lightheaded and woozy like that. It's weird. So the slow drip is sometimes better, and then sometimes we just need to pull it out.
Okay, so the next thing that we need to do now is, now that the area's numb, we need to clean the insertion point. So we have 91% alcohol. The higher the percentage of the alcohol, the better it is surgically speaking. So just we're gonna grab a corner of this gauze. We're gonna douse it with the alcohol. And we're gonna clean the area of the incision point aggressively, not like dab it. You have to rub the skin, the epidermis layer of the skin off. So you're aggressively rubbing.
Okay, I'm looking at the airplanes.
Here we go. And you're going, if you enter on the incision line, all that area has less active nerves because someone just sliced them all. So that's a really great spot to go ahead and insert the needle for the aspiration. It was just one clean insertion of the needle. We can see how it's draining. Now, we don't want to leave it like this. I mean, I'm only doing this for the purposes of the video. I'm going to take this part of the tube out, and then we're just going to leave that part of the needle in there and let it continue to drain. We unscrewed it. The needle's still in there. Let me show you. That's the part that leave out. Now, you could just let it drip like that all the way until it stops dripping, but we don't want to spend 30 minutes sitting here for it to drip out, so we're going to reattach.
I want to explain the reason why I'm standing is because gravity is helping us. When I'm laying down doing this, it falls into the cavities of my body and you don't get as much fluid.
So there's the draw. We're going to leave the needle in place, so we're going to unscrew. It's dripping into the cup again. And now so every time you draw, you're saving yourself about 5 minutes. That's basically what you get out of it.
cover your needle. So my husband Steve Kist used to be an EMT, and he used to work in the emergency room when he was taking pre-med classes, so he does have experience working on bodies in this sort of way. Do not try this at home. Go to the emergency room. If your doctor's not helping you, like in my case, ask your friends if they're EMT certified, or, you know, reach out to friends and family if you want to save a couple $100,000, hundreds or thousands.
Tens of thousands.
Or tens of thousands.
Tens of thousands.
Anyway, good news is my seroma is getting smaller. We've been draining it for about every 3 days. I'm guessing it's been going on 2 weeks now, doing it ourselves. And it's about half the size that it was. You guys may remember in my previous videos, it was at the base of my sternum all the way down to my mons pubis, which is like the pubic triangle down there. And from side to side, it was my entire abdomen. And now it's just the bottom half, and it's getting smaller. I've noticed it goes against the recommendations, but when I stopped wearing my compression garments, it started getting smaller. I really feel like the compression garments was keeping the lymph there, not letting it pass through, which doesn't make sense either. Here's a contradiction, because even the compression garments, when I was wearing them, the seroma was building. Like, I started to feel like a sausage inside of it. Like, the compression garment wasn't keeping it from being created. So, and then when I stopped wearing the compression garment, I'm getting more comfortable and it's getting smaller. So I don't really know what that means. Also, just after I stopped using the compression garments, it started getting smaller. Right after that, like 3 days later, when we drained it again, I started using hot compresses, like a heating pad, and it started getting, you know, more healed with that as well. So do what you must. Here's a quick video of the after, looking down. You can see that my stomach is all the same kind of shape now. It's no longer deformed on one side, so that's what it looks like. So you have the before and after of the overhead. Okay, so now you saw how we drain the seroma, and sometimes it's a lot of fluid and sometimes it's not a lot of fluid. As you saw in the collage of the pulls that we've had, we have pulled more since then. Here is a collage of those seroma fluid pulls. All in all, we have pulled 11 times. And being 8 weeks now post-surgery, let me show you what my stomach seroma looks like. All right, so my last pull was 3 days ago. It's very minor at this point, but you can still see that wave. Like when I push over here moves. So it's still there. When I push here, over here moves. And it kind of waves back. It's not very much. Okay, so that's the seroma update. There is another complication that I'm dealing with. It showed its face about a week ago, and I have a clip of that recording. Let me show you that now. So I'm a little more than 7.5 weeks post-surgery. I just wanted to jump in real quick, a little early, and talk about something else that I've been dealing with. And I literally just researched and figured out what it is. So let me show you. It's not very pretty. That is one end of my incision line. And here's the other end of my incision line. They are inflamed and that they're hurting. It's just at the end. And what I'm dealing with is a stitch abscess. It's when the body tries to spit out the stitches that are deep down inside. It's very, very tender. Pus has been coming out, other fluid has been coming out, blood has been coming out. It hurts to touch. It's been hurting me for about 4 or 5 days now. Actually, you know what? The very beginning, I've been a pain on my incision end points, probably happened about a week and a half ago, but I've just been, you know, being careful with it. The intense pain is probably about 4 days ago, maybe 5 days ago. I have some pictures. I started taking pictures of it because it was hurting me and I noticed it was getting a little bumpy and stuff. So let me insert some pictures here. This is on the 16th and then on the 17th, and then today is the 18th. So the past 3 days. So here is my left side. I feel like you can see the stitch right there, just about to pop out. And when I squeeze this area, just pus comes out and like clear fluid, but it's bumpy. It's very, very tender. It's warm to touch. And this side over here is the same thing. And I feel the stitch, feel like you can see the stitch right here, that black piece. I feel like that might be it. Anyway, it's not very pretty, and it's unfortunate that I have to deal with another somewhat complication. Come on, body, just finish healing already. I'm thankful that I don't have a fever, because the pus that comes out is like gross. Like on this side, it was yellow and greenish. Like it's really bad pus. This side over here is just like a milky-ish color pus. So not very sexy. But I'm glad I don't have a fever. I'm feeling fine when it comes to health-wise. It's just painful to touch. In fact, that's why my shorts are folded down, because even the clothes hurts. Like I can't wear clothing because like I have these little like rags to pick up like the pus that comes out. It's just so like not fun, but it's real and it's raw, and I'm just showing you the journey because it's a journey. All right, so that's enough me chattering on at 7.5 weeks. I'll see you at 8 weeks. Okay, so let me show you what it looks like now, starting with my left side. Not very pretty at all. And going on around my right side. So over the weekend, I took a little trip and wanted to wear waterproof Band-Aids over that sections to just protect it, because I was gonna go swimming and wanted to just not get it infected. The waterproof Band-Aid kept the fluid that was coming out of my body in the Band-Aid area, so that one side looks all red. It was really itchy yesterday when I took off the Band-Aid, and I'm using triple antibiotic in that area. As it dries, the pain is coming back. When it was kind of wet with the fluid, it didn't hurt very much. It was a little sore, but now that it's drying out again, the pain is getting worse. So it's like just annoying. I know it's temporary. The body needs to absorb the stitches, and you know, the entire incision line, not counting the ends, that doesn't hurt at all. My body is absorbing those stitches totally fine. But let's think about it. The end of the stitch mark is where he has to tie the knots and kind of block it in place. It's going to be thicker there. So it's going to take a lot more time and effort for the body to absorb those stitches. I mean, this is what my common sense tells me. And so that's why the end is giving us a problem. So I'm just, you know, taking my time with it and resting. I want to start exercising. I want to go back to the gym, and I want to start yoga again. However, I don't want to overstretch and overwork myself and cause more problems. So I am taking it easy in that aspect. I am 8 weeks now, so technically I'm supposed to be clear to go. But I just don't know, because it's opening like on the sides. So I don't want to like do any moves and cause it to rip open more. I'm just gonna take it easy until I feel like it's the right time. Okay, oh, let me take a standing distance recording so you can see what my body looks like at a distance. I feel like I'm not even. Like I'm lower here and higher here. That seems a little silly, but it is my body now. In the back of me. But when I'm wearing clothes, you can't really tell. It just looks like a waist. So I'm not going to be too picky. In regards to pain, I don't feel pain on a constant basis at all. I do just have the pain of the stitches being spit out. When it comes to the liposuction pain in my arms, it's minor. Like if I touch it, it's minor. I can stretch my arms now and I don't feel any pain. I used to feel pain when I would move my arms. I don't anymore. When it comes to the liposuction area of the waist, I don't feel any pain there at all. I'm not sore. And then here as well, because I had my chin done. I hope you can see. I'm loving the liposuction that was done on my arms. I'm loving the liposuction that was done on my chin and my waist, even though it's not completely balanced. I'm happy with my body. I'm happy with my results. For the price that I paid $5,500. I am fantastically happy with my results for that price. Holy cow. In regards to post-surgery therapies, the radio frequency sessions we did at home for about 10 to 12 sessions, and then we stopped. We did them every 4 days, and we did them 10 minutes per area. So 10 minutes on this arm, 10 minutes on this arm, 10 minutes on my abdomen. And the rolling pen and the other roller that I was using, I used that from 2 weeks till about 5 weeks. And I did it every day for about 5 minutes on each section. And what else? Did I do any other therapies? Oh yeah, the lymphatic drainage massage. We did that every day for the first 2 weeks. And then we did it intermittently after that. I had a really good lymphatic drainage massage at about the 4-week mark. Actually, in that last video in Houston, that was fantastic. She was great. That was my last lymphatic drainage massage. But do keep in mind, when we were doing the radio frequency, he was massaging me during that. So, I mean, that was kind of, also, that was massaging me also. Any other therapies did we do? I don't think we did any other therapies. No, just radio frequency, the lymphatic, and the rolling pens. Yeah. So I'm feeling great. I'm happy with my results. I'll see you guys back for another update at 6 months. At 6 months, that's when I'm gonna take my measurements and compare them with my before surgery measurements. I don't care what the numbers are because I'm happy with my body, but I told you I would do it, so I'm gonna go ahead and do it. I hope you've enjoyed seeing my fish tank in the back. I have a betta fish in there. It's a rosetail betta. Right now, she's over in this corner, or he is over in this corner. And he is making a very big nest in there. Anyway, so you've met my cat, you've met my fish. I have another fish and I have another dog. Well, I have a dog too. I don't know, have you met my dog? I'm not sure if you've met Dustin or not. Anyway, so this is my 8-week update. If you have any questions, please send me an email or send me a message here. Leave a comment down below. I'll get back to you. I'll reply. If you'd like to connect with me on Instagram, the link is down in the description box below. You can also just search me, Tori Kist, and I'll come right up and you can follow me there. If you appreciate my videos and sharing my journey with you, please give me a thumbs up. It really means a lot to see that. And if you'd like to know when my next videos come out, click that subscribe button and the bell icon and you will be alerted. So until next time, bye.